The AIDS Healthcare Foundation, that is AHF, has now urged one of the biopharmaceutical industry's giants, Gilead Sciences, to prioritize the well-being of individuals over financial gains. AHF accuses Gilead of pricing HIV and hepatitis C drugs exorbitantly, rendering them unaffordable for many individuals and allegedly obstructing access to life-saving medications. We now join our health correspondent, Lois Abbasambo, for detail on this.
During a media briefing, the Director of Advocacy Policy and Marketing at the AIDS Healthcare Foundation Africa Bureau, Mrs. Kemi Badamosi, emphatically expressed the organization's concerns, calling upon Gilead Pharmaceuticals to cease what is known as evergreening, the continuous extension of patents on existing HIV/AIDS drugs such as Truvada.
What evergreening simply means is that normally, every patent for medication has a patent life of 20 years, 2 decades. And not the policy and the rule is that once you get to that 20 years, you are supposed to release that medication from a patent medication to become generic so that more people can have access to it. When the time for the patenting is about to elapse, instead of allowing for it to elapse and go into generic, they make small alterations to the medication. Very small. It could just be maybe changing a stripe on the color, which does not really affect the formula of the drug. But of course, once there is a small alteration, what happens? It becomes like a new drug. And so it goes into another 20 years.
This call comes as millions of individuals face the risk of death due to the limited availability of effective treatments.
Gilead to open the license for the generic production of hepatitis C drug Havoni to allow low and middle income countries without exception, to be able to access it. One pill of Havoni drugs in the United States costs $1,000, and you need 12 weeks course regimen to treat it. And that 12-week course of treatment has a retail price of over $90,000 US. Meanwhile, the generic version of that same Havoni costs $4 per pill in India.
The AIDS Healthcare Foundation, with a coalition of non-governmental organizations in Nigeria, is further demanding that Gilead expands access to its patented COVID-19 treatment candidate drug, Remdesivir. The call to end the practice of evergreening existing HIV/AIDS drugs aims to increase affordability and improve access to essential treatments. Lois Abbasambo, ASO Television News.